Hello, I'm Dr.Daksha Bakre, consultant obstetrician and gynecologist working at Cloudnine Hospital, Bellandur, Bangalore. Planning pregnancy? Here are 5 things nobody tells you about. Number 1. You may not conceive in the first go. On an average, any healthy couple usually takes 5 to 8 cycles before they fall pregnant. Very few people are lucky enough to become successful in the first go. So if you don't conceive immediately within the first 2 or 3 months after you have started trying for a pregnancy, don't panic. Usually, we intervene medically only if you have been trying for 1 year or more and if you are under the age of 35 years. But if your age is more than 35 and if you have tried for more than 6 months and have not become successful, then it is time to visit your doctor. Number 2. You have to find out about any hereditary conditions from both your and your husband's family. If there are any genetic conditions or hereditary conditions like sickle cell anemia, thalassemia, hemophilia, any blood dyscrasias, or any musculoskeletal disorders, any autoimmune disorders like SLE, then you should report it to your doctor before you plan pregnancy, because the doctor might want to do some additional tests to make sure that you have a safe and healthy pregnancy. Number 3. You should take folic acid supplements from at least 3 months before planning pregnancy. And not just you, your husband should also take folic acid supplements. The role of folic acid is to help formulate very good quality DNA. 50% DNA comes from you, 50% DNA comes from your husband. So if both partners are taking folic acid from 3 months before pregnancy, the chances of miscarriages or chances of physical abnormalities within the baby reduce significantly. Number 4. There are certain conditions that we screen for before you become pregnant. There might be certain vaccines that you might need before you plan your pregnancy. For example, if you are not immune to rubella, then it is wise to take the rubella vaccine well before you plan pregnancy. If you have never had chickenpox or have not received the chickenpox vaccine, it is wise to get the chickenpox vaccination done before you plan pregnancy. If you receive these vaccines, you need to defer planning pregnancy for a period of 2 to 3 months. Number 5. Do not take any medicines without consulting with your doctor when you're actively trying for a pregnancy, especially over-the-counter painkillers, antibiotics, medicines for cough and cold, or pimple tablets. These can cause harm to the growing fetus even before you come to know that you're pregnant. So whenever you are trying for a pregnancy, avoid taking any sort of medicines without consulting your doctor. All the best.